Menopause. Menopause refers to permanent cessation of menstruation at the end of reproductive life due to loss of ovarian follicular activity. It is the point of time when last and final menstruation occurs. Menopause is confirmed by amenorrhea, which means stoppage of menstruation for 12 consecutive months. Climactic period refers to the period during which a woman passes from reproductive to non-reproductive stage. Perimenopause is said when menstrual cycle is likely to be irregular. Postmenopause means after menopause. Menopause usually occurs at the age of 50 to 52 years. Cigarette smoking or malnutrition can result in early menopause. A few of the organ changes seen during menopause are fallopian tubes atrophy, ovaries shrink in size, uterus becomes smaller, vagina becomes narrow due to loss of elasticity, breast fat is reabsorbed and the glands atrophy, loss of muscle tone resulting in pelvic relaxation and uterine descent. Let's see the menopausal symptoms. Hot flushes and night sweats, which means sudden feeling of heat followed by profuse sweating along with perspiration and cutaneous vasodilation. Secondly, dyspareunia, which means painful sexual intercourse in women. Dysuria, which means pain while urinating. Decrease sexual desire, which can occur due to estrogen deficiency. Crowfeet appearance around the eyes. Purse string appearance around the lips. Osteoporosis of the legs. Anxiety, headache, insomnia, depression. Postmenopausal can result in dementia and Alzheimer's disease. Clinical anatomy of menopause. Premature menopause is when menopause occurs below the age of 40. Delayed menopause is when menopause fails to occur even beyond the age of 55 years. Artificial menopause is when permanent cessation of ovarian function is done by surgery. Management for menopause. Counseling. Women should be explained about the physiological events to minimize anxiety and depression. Lifestyle modification, that is including physical activity to day-to-day routine, decreasing coffee intake and decreasing alcohol intake, including calcium supplements, vitamin D, balanced diet and exercises. What is hormone replacement therapy or HRT? HRT is used in menopausal women to overcome short-term and long-term consequences of estrogen deficiency. Benefits of HRT: improves the vasomotor symptoms, increases bone mineral density, decreases the chances of hip and rib fractures. HRT involves estrogen and progesterone therapy. This might be in the form of subdermal implants, estrogen gel, transdermal patch, vaginal creams. However, this can cause irregular bleeding. Prior to HRT, that is hormone replacement therapy, pelvic examination, blood pressure recording, breast examination, and pelvic ultrasonography should be done. Women receiving HRT should supplement their diet with extra 500 mg calcium daily. Total daily requirement in postmenopausal women is 1.5 grams. Duration is for 3 to 5 years with the lowest effective dose. The FSH-LH test should be done about 6 weeks apart. FSH is follicular stimulating hormone and LH is luteinizing hormone. Contraindications of hormone replacement therapy is neoplasms, liver or gallbladder disease, undiagnosed genital tract bleeding, and previous history of venous thromboembolism. Complications of hormone replacement therapy: endometrial cancer, breast cancer, venous thromboembolic disease, which is also called as VTE, coronary heart disease, and gallbladder disease.